Good afternoon, everyone. Over the weekend, thousands of Missourians turned out for protests across the state. And we are very grateful that these protests were peaceful and nonviolent. And I want to thank all the protesters for peacefully pushing for change. We're glad to have our National Guard troops back home here in Missouri from D.C. also. I also want to thank all the local law enforcement officers, sheriffs, highway patrol, National Guard, and everyone who has been involved in keeping Missourians safe over the past couple of weeks. As a former law enforcement officer, I know how difficult this job can be, especially right now. These are challenging times for our state and our nation, but I want you to know that we support you and appreciate all that you do for the people of this state. With that, Colonel Olson is here today to give an update from the Highway Patrol. Colonel Olson.
Thank you, Governor Parson. I appreciate the opportunity to be here today. Incident to protest activity, which on some occasions has resulted in civil unrest in our state. The patrol has been providing assistance as needed throughout Missouri, but primarily in Kansas City, Jefferson City, and in the St. Louis area periodically since May 30th. The patrol's presence has been one of support and has come at the request of local police departments and local elected officials. We have been primarily focused on the interstates, ensuring traffic flow is uninterrupted, as well as policing in and around protest areas at the request of local law enforcement. Additionally, we have worked closely with the Missouri National Guard in assigning soldiers and allocating other resources to assist Missouri communities. We've experienced a wide range of response from citizens, including damage to patrol cars, rocks and other objects thrown at troopers, and in one instance, a trooper was fired upon. We are fortunate that none of our troopers have been seriously injured. We have been and remain available to assist our law enforcement partners around Missouri as the need occurs. Peaceful protests are how voices can be heard, and I encourage every protester to exercise their constitutional rights peacefully and lawfully. I hope each of you will watch out for your neighbors, their businesses, and the community. Criminals who loot and destroy our communities, our cities, and our towns will only leave behind a path of destruction for all of us to fix and clean up. Over the past weekend, we've seen protests move toward a more peaceful expression. I'd like to thank those members of the public who have reached out to our troopers during these protests. They're proud to serve and will protect and will continue doing so. Businesses, churches, civic groups, and individuals have delivered food and drinks, as well as cards and other expressions of thanks to our officers and to our troop headquarters as well. And I appreciate that very much. If it were practical, I'd contact all of you individually to express that, but since it's not, thank you. Every day, our troopers carry out our mission, which is guided by our 8 core values of integrity, responsibility, respect, resourcefulness, compassion, commitment, character, and professionalism. Troopers are here to help ensure a safe and peaceful environment for protesters while at the same time helping to safeguard lives and property. Thank you.
Thank you, Colonel, and thank you for all the troops and what you've been doing over the last 2 weeks and what you do every day out there. Thank you very much for that. Last week, I traveled to different areas of the state to meet with local leaders, the clergy, and members of the African American community. On Thursday, we have another meeting scheduled with community leaders from Kansas City, St. Louis, Columbia, to listen, to learn, and better understand the needs. There is no room for racism in Missouri. And if we are truly to make a difference in our society, it's going to take all of us listening to one another and working together for a greater cause. In the midst of everything, we must also continue forward on the COVID-19 front. Phase 1 of our recovery plan expires on Monday, June the 15th, and we will be addressing that during Thursday's briefing. Just to recap, Phase 1 of our Show Me Strong recovery plan took effect on May the 4th. This was dependent on the 4 pillars of our recovery plan: testing, PPE, hospital capacity, and data. We have not only met these pillars, but exceeded them, and we continue to monitor our progress each and every day. During Phase 1, we have especially ramped up our focus on COVID-19 testing. And as I have said many times, testing will be the key to Missouri's full economic recovery. The more testing we do, the more knowledge and data we have, and the more confidence and reassurance we can give Missourians that it is okay to move forward. A couple of weeks ago, we announced a plan to rapidly increase our testing volume in Missouri. Since that time, we have made outstanding progress, well surpassing our overall goal of 7,500 tests per day. Today, Director Richardson is here to give you an update on the testing strategy across the state. Director?
Thank you, Governor, and good afternoon. I'm excited to have the chance to give you an update on Missouri's efforts and our progress on COVID-19 testing. As the Governor mentioned, testing is the first pillar of Missouri's Show Me Strong recovery plan and is the key to not only containing the coronavirus, but to entering a sound and sustainable economic recovery. Since the start of the pandemic, the state of Missouri has focused on expanding our testing capacity and access to the supplies necessary to increase the number of tests performed in the state. We have steadily increased our testing capacity in both Missouri-based and national laboratories, and we have not stopped pushing to ensure that Missourians have access to COVID-19 testing when needed. While we have work left to do, we have made tremendous progress. Weekly testing has increased more than 220% since April 20th, from approximately 16,000 test encounters that week to more than 53,000 encounters the week of May 25th. The Department of Health and Senior Services has expanded their testing guidance to medical providers to encourage broad-scale testing, including of asymptomatic people, if their clinical judgment indicates a test is warranted. This means that doctors should feel comfortable ordering COVID-19 tests in situations like when a patient has had known exposure to the virus or when they might need a test to return to work. But we did not stop there. In order to ensure that Missouri was using every bit of its available testing capacity and to ensure the safety of its citizens, Governor Parson challenged us not only to increase our testing capacity, but also to increase the use of that capacity, setting a goal of 7,500 tests per day. The state rose to that challenge. On the 19th of May, when Governor Parson issued his challenge, there were 5,555 PCR tests performed on that day. 1 week later, we had more than doubled that number. On May the 26th, more than 12,400 PCR tests were received by Missourians. And over the last 2 weeks, we have averaged more than 10,000 tests conducted per weekday. Unprecedented events have created unprecedented collaboration across our state departments. Cross-departmental teams have been working tirelessly to answer the governor's call. The teams that have led this effort included the Department of Health and Senior Services, the Office of Administration, the Department of Mental Health, the Department of Public Safety, Department of Corrections, Missouri Veterans Commission, the Department of Social Services, and the Department of Economic Development. Each team received logistics, planning, and staffing support from the Guardsmen and women of the Missouri National Guard. Not only did these teams reach their goals, they exceeded them, shattering the record for the most tests performed in a single day, and, Governor, your target. These efforts are about more than just numbers. They are focused on increasing testing for our most vulnerable, those in the state's care, and to expand testing access across our state. The state focused first on working to box in outbreaks at long-term care facilities, where in other states the mortality rates have been shockingly high. Missouri is supporting testing now in every staff member and of every resident of long-term care facilities that have had a single recent positive case. In the past 2 weeks, 108 facilities have performed facility-wide testing, totaling over 13,000 tests, which identified 79 staff and 180 residents with COVID-19 who were previously unidentified. This effort is saving lives by ensuring that outbreaks are being contained, that appropriate infection control measures are being used, and that positive staff and residents are properly quarantined. Second, the state has provided baseline sentinel testing for residents and staff in state facilities and in congregate care settings, totaling more than 12,500 tests. The Department of Mental Health has tested residents and staff at 14 facilities and identified 21 positive staff members who are now safely self-isolating away from vulnerable patients and preventing further infection. Similarly, the Missouri Veterans Commission tested 4 veterans' homes and identified 2 positive staff members, protecting our aging veterans who are in the state's care. The Department of Corrections has tested staff and inmates at 3 prisons, 2 of which, we're happy to report, had 0 positive cases. At the 3rd, the department identified 6 staff and 15 offenders who tested positive. The Department of Social Services has tested 21 facilities in our Youth Services Division and identified 6 positive staff and 18 youth. These baseline sentinel tests show us that our infection control measures are working, but they've also shown that testing will make those measures even more effective. They ensure that those who are in the state's care are safe from catching the virus and from staff members that come and go into these facilities, many of whom don't even know they could be putting clients at risk. Our third line of effort was community sampling, where COVID-19 tests were provided in 11 counties, totaling nearly 11,000 tests. Community testing increases access to testing while giving the public and our local health departments better information about the spread of the virus and the ability to predict potential hotspots. The good news is that out of that 11,000 tests conducted, only 107 of our citizens tested positive, and they are now safe quarantining. That means the total test positivity rate was approximately 1% across all those 11 jurisdictions. All of these lines of testing provide both critical information that will inevitably save lives, especially amongst our most vulnerable citizens. But this information should also give us a great deal of encouragement, because the overall cases were lower than we expected in many instances, and we are containing outbreaks where they might otherwise have been much more severe. And we should also be encouraged because more Missourians than ever have access to testing when they need it. As our capacity continues to grow, we will work to continue to increase that testing volume to protect our most vulnerable and to create a sustained economic recovery. Thank you, Governor.
Thank you, Todd. Let me also say today, just kind of finishing up here a little bit, there's been a lot of discussion over the weekend about defunding the police departments, about how to move forward in across the country and even in this state. A lot of things have been said about this. What happened in Minnesota was a tragedy, and the officer was charged with murder, which he very well should have been for what he did. Every day, though, police officers go out there, and the large majority of them, 99% plus, do the job they should be doing day in and day out. No more than a little over a year ago, 2 years ago, when I became governor, people were asking me for more police officers. St. Louis, Kansas City, where some of the highest crime rates were asking me to send the highway patrol in. They wanted more officers on the ground. Homicide rates were extremely high in the state of Missouri. And today, they're continuing to get higher while we're here talking of all these things. Doing away with police officers, law enforcement officers, is not an answer for anything. You want to change the way we do business? You want to make things better? We can all do better. I can do better as governor. Law enforcement, never hurts to learn, can do better also. All of us can. But the reality of it is every day, whether it's the tornadoes that happened early on when I was governor, was the drowning incidents in Branson where people drowned. Law enforcement went in there and recovered those bodies. Whether it was tornadoes, when tornadoes hit the state, it was law enforcement that were the first ones on the streets, protecting people. And I can go on and on down that list. It's law enforcement's going to come when somebody calls 911. Nobody else is going to come. Those are the things that we need to remember sometimes about what it is when we talk about law enforcement. 38 law enforcement officers in the last 50 weeks have been killed in the line of duty, have been shot and died. I don't think there's anybody in this room could tell you what the color of their skin was when I asked that question of 38 people. What I can tell you of those 38 officers that lost their lives, they were public servants, and they did it for somebody else. And it goes all the way from a motorist assist to domestic violence to a bad drug deal, all across the country. They give the ultimate sacrifice. To try to blame all law enforcement for some bad actors in law enforcement is not the answer. It's not the answer. To get rid of the bad operators is the answer. To figure out how we can do better, we need to have that discussion. And we need to have that discussion on the ground level where it really affects the people that live in those environments that we're all talking about. But I'll also tell you this. For the discussions I will have with people, it will include education for young people. It will include how you get them an education. How do you give them the ability to get a job? Not more free stuff, not more government programs. How do you really change society? And for us to do that, that's what it'll take. It'll take governors sitting down with people in communities that maybe we don't always sit down with enough and try to figure out how do you do real changes. That's what will be important for all of us. But pit society against one another is not the answer. We all have a purpose for being here. And we all need to figure out what that purpose is from time to time and sit back and think about the things we do have. And a lot of people worry about all the things they don't have, and sometimes we need to be appreciative of the things that we do have. And we need to figure out solutions. And I firmly believe by us working together, really trying to make a difference, we can make changes. But we all have to work together to do that and try to keep one another safe. I will be attending the visitation of a retired police officer, David Dorn, tonight, and the funeral of DeKalb County Sheriff Andy Clark tomorrow, who both sacrificed their lives for other people. Both of them did. And no matter whether he was retired or whether he wasn't, he spent his time being a public servant. I'll be back on Thursday. We'll talk more about Phase 1 order that expires on Monday. And Director Dixon will be here with Economic Development. He'll give some insight into how we're going to help with that on the recovery of that. In the meantime, I encourage everybody in this state to be safe, to use common sense, to be proactive, and to think about each other. Thank you, and God bless. We have Director Karsten's here today, the Colonel's here, to follow up, Dr. Williams is here, and Director Richardson here if you want to ask any questions to them. Let's open it up to them first, Kelly, and then I'll finish up with questions.
Good afternoon. Thank you.
How are rural hospitals doing with PPE right now?
You know, that's a good question. I think it's best to ask of Dr. Williams, but I will tell you from the SEMA perspective, we continue to provide PPE to those that have made requests. We know that those are rural hospitals are in that category of requesting. I don't have the numbers with me today, but thank you for that question. Thank you.
Hi, Colonel.
Hello.
Over here.
Yes.
What were the similarities and the differences between the response to civil unrest this time versus back in Ferguson in 2014, both in terms of how you responded as an agency, but also the reception to your response?
We have certainly discussed that frequently over the last several days. Similarities, of course, this is civil unrest based on a police action and an unfortunate tragedy that resulted in a death. And so those things are the same, but the reaction, I believe, this time and was a much more acute, directed, violent response at law enforcement that we had last time. I think it spiked a little quicker. And of course, we're still monitoring all these situations. Last time it was a little bit more of a protracted event and was more confined maybe to one jurisdiction, whereas here we've been working statewide. Those will be the primary differences.
And, as an agency, what did you learn from your experiences responding to Ferguson versus now lessons that you applied?
Well, since then, we've built a community outreach program, I believe, that's been effective. We have trained our officers in not just reacting from a mobile field force aspect, but in further de-escalation techniques, how to deal with a variety of other types of situations, mental health and those types of things that can come up. We have formulated better policy, I think, in this about a 6-year period now. So those would be some of the highlights.
Thank you.
Yes.
Some other states and cities have banned chokeholds by police. What's your position on that?
Well, currently we do. We have a variety of hand-to-hand type techniques and things that we train upon. We do have a vascular neck restraint technique that we have utilized for many years. We will continue to evaluate the effectiveness and the necessity of that. We also, and I would emphasize, do escalate the de-escalation portion of that very strongly in the training, and I think that's an important aspect to understand.
Well, would you support prohibiting them like other states and communities have, or do you feel like it's still a worthwhile?
I think I would need to talk to the experts in the training field to see what the best direction is to go before I would make a decision one way or the other, but I'm certainly open to any and all suggestions as it relates to that topic.
You mentioned briefly their de-escalation techniques. Could you talk about what officers do currently go through for de-escalation training?
Well, a lot of it just has to do when we engage ourselves in a given situation where we might be escalating force. Once we have a situation that is secured, we train our officers to take the force that's necessary to effect your lawful objective, but then look to de-escalate it and move on with the particular business at hand as quickly and as safely as possible. That would be the bottom line emphasis there.
Being in law enforcement, would you say that officers are properly prepared in the de-escalation technique? Should there be more, as we're seeing other states call for further de-escalation technique training?
Absolutely, and I'll speak just for the patrol. I think we can always look to improve there, and we will have some opportunities to do that moving forward, and we will be looking at that.
Is there any update on antigen testing being done in Missouri?
Yeah, we now make that reportable within 24 hours. Very limited are being done. To my knowledge, we've only had one positive when I checked, I think, on Friday. It's interesting because there are 1,000 platforms. The Sophia platform are existing in Missouri to the tune of 1,000. But the rate-limiting step appears again to be cartridges. And so, there's been a lot of national attention that this was going to be cheap, $32 a test, point of care, you could do it quickly right there in the doctor's office. But I think the limiting factor right now is getting enough cartridges in the hands of those doctors and clinicians to use it. But it remains to be seen in 2 months if that's going to be tremendously helpful. There's some people who think it will, and we certainly hope it will. But we have the platform to do it if it comes. But thank you for the question.
Can you explain how the state is handling contact tracing? Is that something that you're overseeing, and but it's at the county level, or is the state going to hire actual tracers?
Yeah, Kirk, thanks. The state is overseeing that, the plan on how to do that. Let me put it that way. I hope that will be available. There's a lot of robust analysis of that. We think it's really, really important. To your point, it involves different groups. It involves the state. It involves local health departments who identify the cases. And so I would tell you that there's a robust analysis of how best to do that, looking at other states. And as soon as that is available, then we will certainly make that available to you. Thank you.
A testing encounter, just to be clear what that is, that's a nasal swab test that's done and completed and analyzed?
That's for the antigen testing, and that's for the PCR. Yes, it's a nasal swab. Antibody testing is blood testing.
So a test encounter is both antibody and PCR?
I'm sorry, I didn't understand you.
I'm looking at the charts here.
Oh.
So a test encounter is both PCR and antibody testing?
I can't see the chart in front of me, but I think that is all specifically PCR testing. We've clearly separated. We've done 30,000 antibody tests in Missouri. Positivity rate's about 3%. We've done almost 300,000 PCR tests separate from that. And right now our positivity rate for a 7-day rolling average is about 3% as well. Overall, it's about 6.7 since we started doing them overall.
Thank you.
Yeah, good.
Community testing numbers, that wait list filled up pretty fast, especially
Yes.
in Columbia. When can we expect more community testing?
It's coming. We are identifying the sites now. I don't know the exact timeline. Todd might exactly when those roll out, but it's an additional number of sites. I don't know if we settled on the final number. The governor and I and Todd are on lots of phone calls during the week with hospitals and community leaders, and they've all expressed an interest. And I think to our credit, we've been really responsive. When somebody asks, could you come? We've come. I was up in St. Louis yesterday at Christ Community Temple with Dr. Harper's congregation there in the parking lot doing testing. And so it's just been really gratifying from my sense to actually see the people and how much they appreciate it. They really do. And it's just, as a clinician, you like to help people, and I clearly think this has really helped a lot of individuals, as it's also helped kind of our population dynamics as well. So,
And will there be a higher capacity for that testing, or it depends location-wise? How does that work?
I think I haven't seen the final numbers or how many sites, but I think, we did 3,000 in the first tranche, and we did 10,000 in the second one. I don't have an exact number for you for the third yet, if that's been determined.
Thank you.
But if you know of a community that's interested, whether it be a church or a community, we certainly would love to hear that. And again, can't thank the people enough. Yesterday was a hot day to come out and get tested, so thank you for that.
Hi, Dr. Williams.
How are you?
Good, how are you? So, some hospitals still require a physician's note to get tested for COVID-19. What's it going to take for the state of Missouri to allow anyone to walk into a clinic to get a test, especially with all these large protests and businesses opening up?
They can do it now. Thank you for raising that question. For just, other than the state lab, which has fairly, more screening criteria since it's the safety net, thank you for asking the question because it'll help us get out the message. We really want to encourage anybody who wants to get a PCR test to see if they might actually have COVID-19, or if they want to get an antibody test to go and see if they've been exposed somewhere along the line. We really encourage them to contact their clinician. They do not have to be symptomatic. They can just go in, if they're willing to do it, and get the test. So anything you can do to help get out that message, we would greatly appreciate.
And then yesterday, the World Health Organization talked about asymptomatic people not being able to transmit COVID-19, but then rolled back on it this morning. Can you just clarify, what they were saying and just COVID-19 transmission in general?
First of all, I want to commend y'all for doing your homework and for reading that article. I woke up this morning bright and early reading that too. So thank you. So the point that's being raised is that, as you can remember back in March and April, the sense was that there weren't that many asymptomatic people. And then it came out that people were testing positive when they were asymptomatic, and there was the concern that if you follow those people long enough, they became symptomatic. So really 3 groups of people: symptomatic, pre-symptomatic, and totally asymptomatic. The World Health Organization yesterday, as you pointed out, said that they felt like, while they weren't ready, I don't think, to stand behind it completely, that asymptomatic people were not that infectious. And so that presents another whole variable to it. And as I've said to you almost every day now for 3 months, in an emerging viral disease, it's always going to be learning more. So right now, a real point of emphasis is just how infectious are these asymptomatic people. We've always felt they weren't as symptomatic as somebody coughing and projecting droplets on you, which we think is the primary way that it's spread. But now there's this whole new field of inquiry, just what it means to get a test and be asymptomatic as far as infecting others. Now, that same World Health Organization study pointed out, which has been our own experience in Missouri, if you take somebody who says they're asymptomatic, when you test them, and you follow them for another 7 days, and you really watch them closely, many of them will be mildly symptomatic. And so that raises the whole question for that group, the asymptomatic, the mildly symptomatic, how infectious are they really? So I'm sorry to give you such a long-winded answer, but it's a great question, and it just speaks to the fact that every day we're learning. The governor says get better every day, and that means paying attention to what's being published, to look around and adapt and course correct as you learn things. So that's something on this particular day we're watching very carefully, the meaning of those asymptomatic people as far as infecting other people. Thank you.
Thanks.
All right, Kelly, we ready to finish this up?
Hi, Governor. How are you?
I'm good.
Good. Some states are setting up special locations, special testing sites for protesters for COVID-19. Wondering if this is something you're considering not only for protesters, but the law enforcement that are out there, the National Guard in Missouri, and also those that were sent to D.C.
Yeah, I think right now we're putting testing as a priority wherever they want it. We can provide it for it. We got a lot of availability to do mobile testing. We're doing that for churches. We can do it for law enforcement. We can do it where we need to go. Probably Todd or some of them could address the plan of that. But I haven't been requested to do that. But that they would have more of an idea on that than what I would. But we'd be able to do it if somebody asked for it.
I also saw on national news that some of the National Guard members being sent to D.C. from other states are being allowed to leave. Are the Missouri National Guard members still in D.C.?
No, they just returned home.
Are you suggesting that they self-isolate at this time?
No,
Okay.
I'm not.
Over the weekend, a Florissant police officer in St. Louis was suspended and currently is under investigation after a video shows that he hit a suspect with his vehicle and then got out and hit him multiple times physically. What is your response to that?
Well, yeah, due process needs to take place. I'll say what I said about the officer in Minnesota. If you're a bad actor, you need to be called out on it. But again, I'm not sure all the details other than what I've seen on the media, and I haven't even seen the video other than what I've heard. But, look, I don't care whether you're a law enforcement officer or a private citizen. You got to be accountable for your actions. And law enforcement, through my entire career, will hold law enforcement officers to a higher standard than I would the normal person. I always have done that, and I always will, because I think the trust in them, along with the job they do to be public servants, they have to be accountable at a higher standard than most. Fair or unfair, that's the way I view the world as a law enforcement officer.
Thank you.
Heading into phase 2, assuming that the restrictions are lifted, what's it going to look like? Are we still going to have some restrictions? Are businesses limited in how many people they can have, things like that? Or is it going to be wide open?
You're going to ruin my Thursday briefings, what you're going to do by asking that question on that. We'll get into a lot of detail on that Thursday for you, but it will be definitely about reopening the state of Missouri.
There have been a lot of proposed police reform measures, including the banning of chokeholds. Is there any particular one of those that you would support?
Yeah, I think, again, I kind of echo what the Colonel said here. There's different types of training, how you use the use of force. Use of force should always be at a minimum until you have to use it. There should be a lot of other actions be taken before you ever do force. And that's the training law enforcement officers go through. So I think if there's something there needs adjustment on it, we need to change the way we're doing business. I think you put it on the table, we'd have that discussion and see how we move forward. But again, I think there needs to be people at the table that understand the issues and what that's like to make those decisions. I just don't think you can go out here as an elected official all of a sudden says, this is wrong, that's wrong, if you don't have any experience in it. That's why it's so important to me to deal with the clergy, to deal with some of these young activists that are actually going through this, to understand that. And for the average citizen out there that don't know what it's like, what they're going through, until you sit down there and talk to them and get a feel for that, you don't really understand. And if you're not a law enforcement officer, it's hard to understand what they go through every day. The minor things they go through, the legitimate things they do every day that nobody ever cares about just because of what they go through. No different than the police officer this morning. I don't know all the details, but in Springfield, he gets rammed by a car. Has nothing to do with protests, has nothing to do with racism or anything else. It just one of those things that happens when you wear that uniform.
All right. I just want to switch to the Chamber of Commerce really quick. So the Missouri Chamber of Commerce is kind of pushing, I think, for a special session to protect businesses from lawsuits. Let's say if an employee goes to work, it's COVID, wants to sue the business. What are your thoughts on that? Yeah,
we're discussing special session. I mean, as we go through like timing, when you do it, how many you would do, and what are those reasons. I think there's still a lot of things out there that we got to figure out what you would call a special session for. But I think anytime we're talking with what the Chamber's talking about on the legal liability of it, sure, I mean, that's got to be something on the table. We're seeing other states do it. But, I'm not interested in a bunch of people taking advantage over good, hardworking people that were out there trying to do a job and then lawsuit after lawsuit against people that were trying to save people's lives. That's I'm not for that. But, again, that's the legislative body to make that decision. But if we have a special session, that'll be part of that discussion.
Hi, Governor. Would like to ask you about the crime bill that passed this session, Senate Bill 600, and some calls for you to veto that based on concerns that it could lead to longer sentences, requiring more prisons to be built. Your reaction to that? Yeah, well, I think we're looking at that now. The legal team is on several of those bills. Hasn't come in yet. See what all's in there. Look, I'm not interested in building more prisons in the state of Missouri. I mean, that would be a last resort for me. I'll just say that on that ending question you had. Look, we got to figure out alternative ways to get people back to work, to get them in society, and figure out how we can sustain that and not just do it for a short period of time. But, again, I haven't looked at the bill until it comes through legal and we go through all the things that are in there. I don't know what all's in it. There's a number of other bills out there. Some of them's got over 30 provisions in them that went through. So, there's a lot of work to be done on them. So I just hate to commit to any bill until I look at it and see and make a final decision on it.
Governor Parson, you said you're going to meet with local leaders in Columbia come Thursday. What's the communication like to how those leaders are picked? How many people are in the room? What's the discussion like? Well,
this particular meeting, there was an outreach. They contacted us, wanted to sit down and meet with us. When I was in St. Louis, it was a mixture of I would say pastors, senior pastors, clergy up in St. Louis we met, all the way to 20-year-olds that were activists, which was eye-opening for me to be able to hear what they're saying and what they're thinking and what their cause is, I want to say. We went to Kansas City. Same thing. You had a mixture of people in there, I want to say, that was at that. Probably 40, 50 different people from there, and different all kinds of ranges, all the way from citizens to clergy to citizens. But again, I will echo what I kind of said in St. Louis. There's a couple of young men there that one of them was part of the clergy, and he was in his 20s. He was an activist. I mean, he believed in the cause of what he was trying to do, and he believed in changes. But I also believe he understands the way you do that is to sit down and try to figure out what is the solution, what's the end game. And the end game's not a short game. I think we're kidding ourselves as society as a whole if we just think we're going to go up there and change a little piece of regulatory environment. I think you got to be thinking, do you really want to change society as a whole? That has to be part of the discussion at the table. So those people that are willing to sit down and talk about that, I'll do that, and not only will I sit down and talk about it, I'll try to find solutions and try to work with them. The group in Columbia, one of the reasons it's in Columbia is simply there's people from St. Louis and Kansas City coming, and instead of trying to get them all to Jeff City, I just said I would go to Columbia and meet them in Columbia. So that's the significance of Columbia. But there'll be younger people there. There'll be some activists there. There'll be some clergy there. I'm not sure who all will be there, but again, it's to start the process to really figuring out what can we really change. One of the crime bills that was brought up a while ago, one of the main crime bills that I had a lot of involvement in last year with a lot of the civic leaders across the state, the African American community, was a bill that didn't get done. And when you talk about special session, things like that, I think those are things that really have an impact that we can pass and that could have an immediate impact in those communities when it comes to violent crime. Some of the things that were in that. So that's one of those things, going back to special session, I think there's things like that are very important to get done. But there's no special pick or place of who comes. We're just trying to sit down there and start that dialogue of trying to figure out what are we really going to do from a legislative point of view? What am I going to do as governor? What can I really tell these people that's really realistic? And if they're asked for something I don't, then I'm going to tell them the truth. I'm going to say, hey, I don't see how you get that done. All right, thanks everybody for being here today. Thanks.